Gel injections for knee arthritis are everywhere right now. Some clinics call them revolutionary, others say they're just expensive snake oil. But what's the actual truth? Today we're talking about hydrogel injections, especially a newer treatment called Arthrosamid, and whether they really work for knee osteoarthritis. Can they delay knee replacement? Are they better than steroid injections or hyaluronic acid? And what does the latest scientific evidence actually say? I'll break down the current research, the pros, the risks, and who may or may not benefit. Osteoarthritis is not simply wear and tear, it's a complex condition involving cartilage breakdown, inflammation, changes in the bone, and degeneration of the entire joint environment. Patients usually experience pain, stiffness, swelling, reduced walking tolerance, and loss of function. Treatment typically starts with weight management, exercise therapy, physiotherapy, pain relief, and sometimes injections. What are gel injections? Traditionally, most people have heard of hyaluronic acid injections, sometimes called viscosupplementation. These aim to improve lubrication inside the joint, but newer hydrogel injections work differently. Arthrosamid is a polyacrylamide hydrogel made of 97.5% water and to 0.5% cross-linked polyac or ylamide. And like hyaluronic acid, it is non-absorbable, meaning it stays inside the joint. Long-term, manufacturers claim it integrates into the synovial lining and may reduce pain by improving cushioning and altering the inflammatory environment. Why is there so much excitement? The big attraction is this: one injection may potentially provide relief for months, possibly even years, without repeated steroid injections. That sounds appealing because steroid injections usually provide only short-term relief, and repeated use may potentially affect cartilage health. Hydrogels have also been used safely in other medical specialties for many years, including ophthalmology, urology, and plastic surgery. So naturally, there's growing interest in whether this could become a major treatment option for knee arthritis. What does the science actually show? Section title on screen: The evidence so far. A recent 2026 review published in the Knee looked at the current evidence for polyacrylamide hydrogel injections in knee osteoarthritis. Key findings: several studies showed improvement in WOMAC pain scores, stiffness, and physical function. Some patients reported symptom improvement lasting between 6 months and 3 years. However, and this is important, the evidence is still limited. Randomized trial: one of the highest quality studies compared Arthrosamid with hyaluronic acid injections in 239 patients. The result: both groups improved, but there was no statistically significant difference between Arthrosamid and hyaluronic acid at 1 year. So at the moment, we cannot confidently say Arthrosamid is clearly superior. What about safety? Most side effects reported were temporary: pain, swelling, stiffness, or a feeling of pressure in the knee. The most common adverse event was transient pain, reported in around 16% of patients. Importantly, serious complications were uncommon in current studies. But there's a major point to understand here: because Arthrosamid is non-absorbable, it remains inside the joint permanently unless the knee is later replaced surgically. That means long-term data is still extremely important, and currently we simply do not have decades of evidence. The big question: who may benefit? In my opinion, these injections may have a role in carefully selected patients. Mild to moderate arthritis, patients trying to delay knee replacement, or patients unsuitable for surgery, but expectations need to be realistic. If someone has severe bone-on-bone arthritis with major deformity, injections are unlikely to rebuild cartilage or reverse arthritis. Think of it as symptom management, not a cure. Important balance take: this is where social media can become misleading. Some advertisements present hydrogel injections almost like a miracle treatment. The current scientific evidence does not support that claim. The 2026 review concluded that although results are promising, there is insufficient evidence to recommend routine widespread use yet, and further high-quality studies are still needed. That's probably the most honest and balanced interpretation of the data right now. Practical advice for patients: if you're considering gel injections, ask, what grade is my arthritis? What are the realistic expectations? How long might relief last? What happens if it doesn't work? And what are the alternatives? Remember, no injection currently regenerates advanced worn-out cartilage. The foundations of arthritis treatment still remain strength, mobility, weight optimization, activity modification, and good long-term joint care. Outro call to action: so, are hydrogel injections the future of knee arthritis treatment? Possibly. Are they a miracle cure? Definitely not. The early evidence is promising, but we still need stronger long-term research before making bold claims. If you found this video helpful, subscribe to the channel And let me know in the comments, would you consider gel injections for knee arthritis?